In response to a survey sent out by the Trevor Project, which is a national organization that focuses on suicide prevention amongst the LGBTQ youth, in the past 12 months, 48% of youth respondents reported that they engaged in self-harm, and 40% of youth responded that they had seriously considered suicide. This evening, I will present arguments in support of the prohibition of conversion therapy for minors in Idaho. On January 27, 2021, John McCraskey, a Democratic representative and advocate for the LGBTQ community, introduced House Bill 52 to the Idaho State Legislature. His intention is to have the current Youth Mental Health Protection Act amended through the addition of the new section 62-2435, which prohibits conversion therapy for minors. The following day, the bill was reported and referred to Ways and Means. Conversion therapy is becoming less controversial. However, there are still two sides to the argument. One side, professionals are seriously considering the negative effects it has on the mental and emotional health of minors, and on the other side, state representatives such as John Kimbrell in Georgia claims that prohibition of conversion therapy is in violation of a practitioner's freedom of speech. Although I'm not a professional, my credibility for this speech is unbiased, as I am not a member of the LGBTQ community, and I have done extensive research into the House Bill 52 and the practice and effects of conversion therapy. Through my research, I have concluded that conversion therapy should be prohibited as a treatment option for LGBTQ minors. Idaho State Senate should amend the Youth Mental Health Protection Act with the addition of the new section 16-2435, which prohibits conversion therapy for minors. First, because many studies have shown that conversion therapy is often detrimental to the mental and emotional health of minors. And second, therapies that help families and patients facing gender dysphoria and homosexuality reduces suicide risks. To begin, I want to ensure everyone has a clear understanding of conversion therapy as defined in House Bill 52. It states, conversion therapy means any practice or treatment that seeks to change the sexual orientation or gender identity of a patient or client, including mental health therapy that seeks to change, eliminate, or reduce behaviors, expressions, attractions, or feelings related to a patient or client's sexual orientation or gender identity. However, conversion therapy does not mean a practice or treatment that does not seek to change a patient's or client's sexual orientation or gender identity. So to put that simply, what that bill is stating is that therapists won't be able to try and change the patient's sexual orientation. However, they would act more as a neutral and supporting and educational source for the patient to turn to. And the reason why these therapists won't be able to try and change the patient's sexual orientation is because many studies have shown that conversion therapy is often detrimental to that emotional and mental health. And the reason why is many individuals do not understand homosexuality and gender dysphoria and the phobias that continue to exist in our society. According to the American Academy of Pediatrics, therapy that is directed at changing the sexual orientation of a minor is not recommended because it can lead to feelings of guilt and shame and anxiety in the patient. It also typically does not achieve the therapist's goal to change their sexual orientation. To further their claim, The American Academy of Child and Adolescent Psychiatry states there is no evidence to support the application of any therapeutic intervention operating under the premise that a specific sexual orientation, gender identity, and or gender expression is pathological, meaning that homosexuality and gender dysphoria is not a mental illness, it's just who the person is. And finally, the American Psychological Association Task Force concluded that the conversion therapy, or the therapy where you're trying to change the individual's sexual orientation, can lead to many harmful side effects that include depression, which is high-risk depression. Their sexual behaviors are more risky. It can lead to shame, self-hatred, and the odds of them committing suicide. And second, therapists that help families and patients facing gender dysphoria and homosexuality, they actually reduce suicide risks if they don't focus on conversion therapy, but rather seek to help the individual with where they're at in those neutral and supporting environments. So in actually a study done in San Francisco State University, they found that the attitudes and the acceptance of LGBTQ families had a major impact on these individuals, and they found that those who were only slightly rejected or not rejected by their families experienced a lot lower levels of depression. They were less likely to participate in illegal drugs, and they were much less likely to attempt suicide than those who were rejected by their family and their peers and their loved ones. So in reference back to the Trevor survey that we talked about at the beginning, 10% of the LGBTQ youth reported undergoing conversion therapy, and within that 78% reported that their conversion therapy took place while they were under the age of 18. And so the Trevor project, they took this data that they collected for 2020, and upon examining it, they found that the youth who reported that they underwent conversion therapy under the age of 18 were more than twice as likely to attempt suicide in the past year compared to those who did not. So not only does House Bill 52 prohibit conversion therapy for individuals under the age of 18, it also outlines therapy guidelines to help ensure that the therapy LGBTQ minors need is provided for them. These outlines include limitations and criteria, such as it has to be a neutral environment. They have to respect the sexual and gender concerns of the patient. And they need to be able to provide support, be encouraging and understanding, and educate them on the sexual activities, both prevention and actual acts, that are natural for their orientation. And so hopefully with more awareness and better therapy provided for our LGBTQ minors, they can experience a higher quality of life through increased positive mental and emotional health and less suicidal attempts. Thank you for your time.